Welcome to the School District 27J Employee Benefits Orientation. This presentation is brought to you by the Human Resources Department to assist you in your benefits selection. You can either play the presentation in its entirety or select a specific topic according to your needs. As a district employee working 30 or more hours per week in a regularly budgeted position, we are pleased to offer you a comprehensive benefits packet which includes medical, dental, vision, life and accidental death and dismemberment insurance, health savings account if enrolled on the Kaiser high deductible health plan, flexible spending account plans, and an employee assistance program. This presentation will guide you through your options and the process of enrolling in your benefits. It will also give you tools and resources to help you make the most informed decision for you and your family. You are required to submit paper benefit enrollment forms. Before you begin, it may be helpful to retrieve and print the enrollment forms. Please return the required completed documents to District 27J Human Resources Office within 31 days of your first day worked in a benefited eligible position. Be sure to use black ink and please write legibly. In order to be eligible to enroll on the Employee Benefits Program with School District 27J, you must be working 30 or more hours per week in a regularly budgeted position. As a benefits eligible employee, you are able to enroll eligible dependents such as your spouse, common law spouse, domestic partner of same sex or opposite sex, civil union partner, and/or eligible children for coverage at your expense. No other family members are eligible for enrollment on District 27J insurance plans. When enrolling your dependents for insurance coverage, you must provide full names, social security numbers, and date of birth for each dependent. Insurance plan options chosen for dependents must match those of the employee. Eligible dependents enrolled on School District 27J Medical Plan must also be enrolled on District 27J Dental Plan. Eligible dependents enrolled on District 27J Dental Plan must also be enrolled on the same medical plan as the employee. Enrollment of dependents on Vision Plan is optional. Employees can waive medical coverage for themselves and their dependents and still be allowed to enroll themselves and their dependents on District 27J Dental Plan. However, employees cannot waive coverage for themselves and their dependents on the dental plan without also waiving coverage for themselves and their dependents on the medical plan. Employees and their domestic partners must complete and sign a domestic partner affidavit form and have it notarized in order for the domestic partner and their children to receive benefits. Employees and their common law spouse must complete and sign an affidavit for common law marriage and have it notarized in order for the common law spouse and their children to receive benefits. The premium cost to insure the employee only for Kaiser DHMO medical plan, the Kaiser high deductible health plan, the dental plan, vision plan, and life accidental death and dismemberment insurance plan are typically paid by School District 27J. The actual cost to employees will be determined once union negotiations are finalized. An employee co-share of the premium is required to enroll on the Kaiser Added Choice Deductible Coinsurance Plan, referred to as the ACDC plan. Employees must pay premiums to cover eligible dependents on all insurance plans. Employees are only allowed to add dependents to their plan during the first 31 days of employment, during the annual open enrollment period in the month of May, or due to a qualifying event. The definitions of a qualifying event will be discussed later. The annual employee benefits open enrollment period is held during the month of May. During the annual open enrollment period, benefit-eligible employees are allowed to make the following changes to their benefit selections: add eligible dependents not already covered, remove dependents from coverage, change from one medical plan to a different medical plan for yourself and your eligible dependents, enroll or re-enroll on flex spending account plans for the next plan year of July 1st through June 30th, waive medical and dental coverage for yourself or only waive medical coverage for yourself. All changes made during the annual benefits open enrollment period must be submitted in writing on the appropriate enrollment and change forms that are located on District 27J website under the Employee Benefits section by the last business day in the month. Changes submitted during the open enrollment period will become effective July 1st. During the annual open enrollment period, employees will be notified of important plan changes and/or premium rate changes for the upcoming plan year. The benefit plan year is July 1st of one year through June 30th of the following year. Events can occur during the plan year that may allow you to make certain changes to your benefit enrollment. Common qualifying events include marriage, divorce, death, birth, or adoption of a child. It may also include gain or loss of spouse's employer group coverage or gain or loss of coverage under public or governmental health plan. If you experience a qualifying event, please contact District 27J Benefits Office to discuss what changes, if any, you're allowed to make and the required written documentation needed to make the changes. It is important to understand that the majority of qualifying events allow you to add or drop dependents, but do not allow you to change your benefit plan selection. You have 31 days from the date of the qualifying event to submit an insurance enrollment or change form and any required documentation. It is important to remember that the District 27J Benefits Office must receive your change forms and documentation by the deadline dates, or the insurance carriers will not process your request. Generally, the effective date of change is the first day of the month following the qualifying event. However, in the case of birth or adoption, the child will be covered as the date of birth or the date of the adoption. You have 31 days from your first day worked in a benefited eligible position to submit your benefit enrollment forms and any other required written documentation. You can waive medical and dental coverage or only waive medical coverage, but you cannot waive vision coverage. If you want to waive medical coverage under District 27J Medical Plan, you must provide written documentation as proof of current coverage in another medical plan, and you must complete a District 27J medical waiver form. Due to healthcare reform, known as the Affordable Care Act, all Americans are required to enroll in a healthcare plan or pay a penalty. New employees who do not complete an insurance enrollment or waiver form will automatically be enrolled on District 27J base health insurance plan called the Kaiser High Deductible Health Plan. Your benefit plan elections or default enrollment will remain in effect until June 30th, which is the end of the plan year. You will not have an opportunity to change your benefit elections until the next annual open enrollment period held during the month of May. Insurance coverage under the district's health, dental, vision, and life insurance plans begins the first day of the month following your first day on the job, or the first day of the month following the date that you became eligible for benefits as a full-time employee working 30 or more hours per week. The premium cost to insure the employee only for Kaiser DHMO Health Plan, Kaiser High Deductible Health Plan, the Dental Plan, Vision Plan, and Life Accidental Death and Dismemberment Insurance Plan are typically paid by School District 27J. The actual cost to employees will be determined once union negotiations are finalized. An employee co-share of the premium is required for enrollment on the Kaiser Added Choice Deductible Coinsurance Plan. All employees electing coverage for an eligible spouse, common law spouse, domestic partner, civil union partner, and/or eligible children must pay the additional premium cost to cover those dependents. For all insurance plans, premiums are deducted from the paychecks at the end of the month prior to the month of coverage. If your coverage goes into effect the first day of the month and you will not get your first paycheck until the end of that month, the district will deduct 2 months' premiums from your first paycheck. There are enrollment requirements when electing medical and dental coverage. If you enroll on District 27J Medical Plan, you must enroll on District 27J Dental Plan. If you choose to waive medical coverage, you may elect to waive dental coverage. You cannot waive vision coverage. Remember, if you do not want to enroll on medical coverage, you must provide written documentation as proof of current coverage in another medical plan, and you must complete the District 27J medical waiver form. If you do not submit your enrollment or waiver forms within 31 days of your first day on the job as a benefit eligible employee, you will be automatically enrolled on the Kaiser High Deductible Health Plan, District 27J Dental Plan, and Vision Service Plan with employee-only coverage. If you or your dependents are covered by more than one medical insurance plan, the Coordination of Benefits law states that one plan is considered to be the primary carrier and the other is considered to be the secondary carrier. The primary carrier covers the major portion of the medical expenses according to the plan allowance, and the secondary carrier covers any remaining allowable expenses. The coordination of benefits provision of your policy or plan determine which plan is primary. The primary plan's benefits are applied to the claim first. The unpaid balance is usually paid by the secondary plan to the limit of its responsibility. Benefits are thus coordinated among all the health plans, and payments do not exceed 100% of charges for the covered services. Per the Colorado Coordination of Benefits law, the plan that covers a person other than as a dependent, for example, if an employee, member, subscriber, or retiree, is primary, and the plan that covers that person as a dependent is secondary. However, if the person is a Medicare beneficiary, Medicare is secondary to the plan covering the person as a dependent. Medicare is primary to the plan covering the person as other than a dependent, which means the order of benefits is reversed so that the plan covering the person as an employee, member, subscriber, or retiree is secondary, and the other plan is primary. Consider the pre-tax premium election option when enrolling eligible dependents and paying premiums from your paycheck. If you elect to pay your premiums pre-tax, your monthly medical, dental, and vision premiums will be deducted from your paycheck prior to the calculations of federal taxes, state taxes, Medicare taxes, and PERA retirement, thus saving you money and increasing your take-home pay. Employees eligible for medical benefits have 3 Kaiser Permanente plan enrollment options with no pre-existing condition limitations. Kaiser Permanente members have 24/7 access to My Health Manager, a secure online portal allowing you to email your primary or specialty care physician, pharmacist, or other Kaiser providers you have seen for care, order prescription refills, view most lab test results, schedule, view, or cancel routine appointments, review recent office visits, and more. For a preview of Kaiser's website, go to www.kp.org/experience. We will start by discussing the Kaiser High Deductible HSA Compatible Health Plan. Kaiser Permanente High Deductible HSA Compatible Health Plan members will pay the full cost of covered medical services and prescriptions until the annual deductible has been met. Once the deductible has been met, all covered medical services and prescriptions are paid 100% by Kaiser Permanente. The deductibles on the high deductible health plan are $5,000 for an individual and $10,000 for a family. Due to healthcare reform mandates, high deductible health plan deductibles for families are changing effective July 1, 2016, from aggregated deductibles to embedded deductibles. An embedded deductible means that when one family member reaches the individual $5,000 annual deductible, that family member has met their annual deductible, and future eligible claims above $5,000 will be covered at 100%. The other family member claims will apply to the remaining $5,000 annual family deductible. This is an improvement in benefits for families. Employees enrolled on this high deductible health plan may be eligible for a health savings account, or HSA, in which School District 27J will deposit money into the HSA for employees to use to pay for plan deductible. District 27J will deposit $250 per month or $3,000 annually for individuals and $500 per month or $6,000 annually for families into an employee's health savings account. This amount of HSA contribution by School District 27J is subject to final union negotiations. Money into an HSA rolls over year to year and can grow to an unlimited amount. Employees keep the money in their HSA even if they leave employment with School District 27J. Per IRS rules, the 2016 annual contribution limit into the health savings account is $3,350 for individuals and $6,750 for families, which includes both the District 27J HSA contribution and any voluntary employee HSA contribution. The school district contribution to the employee's HSA covers more than half the annual deductible. If you reach your annual deductible on the high deductible health plan during the plan year, you will have no further out-of-pocket costs for any covered services. Due to the District 27J contribution to the employee's HSA, the annual maximum potential out-of-pocket for an individual is $2,000 and for family is $4,000. The contribution to your health savings account will go a long way towards helping you accumulate savings in the future years, as any unspent money in your health savings account is yours to keep, even if you leave School District 27J. Per IRS rules, District 27J can only deposit money into a health savings account during the months that you remain enrolled on the Kaiser High Deductible Health Plan. Kaiser DHMO members will pay co-payments for doctor office visits. These co-pays are $20 for a primary care visit and $40 for a specialist visit. If you have a procedure as part of the office visit, such as the removal of a mole, stitches, etc., these services are subject to the annual deductible and coinsurance. In addition, DHMO members will have co-payments for most prescription drugs, which are $10 for generic medications, $20 for brand name medications for a 30-day supply, and 20% coinsurance up to $250 per fill for specialty drugs, such as self-injectable drugs, excluding insulin. Members who take maintenance medications can also use the mail order services to receive up to 90-day supply for most medications for 2 co-payments. The DHMO plan has an annual deductible of $2,500 for individual and $5,000 aggregated family deductible for most other medical services. Embedded family deductibles do not apply to the DHMO plan. These other medical services may include inpatient hospitalization, outpatient surgeries, baby delivery, MRI, CT, PET scans, emergency room visits, procedures done during the office visit, and more. After the annual deductible is met, Kaiser DHMO members will pay 20% coinsurance until an additional $2,000 for individuals and an additional $4,000 for families is met. For example, if the cost of medical services is $500 and the member has already met their annual deductible, the member will pay 20% of the services, or $100. The total annual out-of-pocket maximum amounts for an individual on this plan is $4,500 and for a family is $9,000. Per IRS rules, employees enrolled on the DHMO plan are not eligible to have money deposited into a health savings account. Kaiser Permanente Added Choices Deductible Coinsurance Health Plan members will be allowed to seek medical services 3 ways. 1, through the Kaiser Permanente network for the lowest out-of-pocket cost. 2, through the private healthcare system network for a higher out-of-pocket cost. Or 3, any medical provider for the highest out-of-pocket cost. Since the monthly premium is much higher for the Added Choice Deductible Coinsurance Plan due to the choice of receiving medical services outside the Kaiser network, employees will be responsible to pay a portion of the employee-only premium in addition to the premiums to cover dependents. Office visit copays to the Kaiser network provider are $25 for a primary care physician and $40 for a specialist. Office visit copays to participating provider in the private healthcare system network are $35 for a primary care physician and $50 for specialist. Your office visit costs if you use a non-participating provider will be 40% of the office visit charge. Prescription drug copay amounts vary based on the network where the drug is received. Copay costs at a Kaiser pharmacy are $25 for generic drug and $40 for a brand name drug. Copay costs for a private healthcare system pharmacy is $30 for generic drug and $50 for a brand name drug. Prescription drugs obtained at a non-participating pharmacy will cost 50% coinsurance. Specialty medications received at Kaiser and participating pharmacies will cost members 20% up to $250 per drug dispensed to retail. Specialty medications received at non-participating pharmacies is 50% coinsurance. Annual deductible amounts vary depending on where services are received. If you receive services through the Kaiser network, your deductible is $2,500 for an individual and $5,000 for a family. Annual deductibles for services received in the private healthcare system network is $3,000 for an individual and $6,000 for a family. If you are seeing medical providers outside the 2 networks, your deductible will be $5,000 for an individual and $15,000 for a family. The annual out-of-pocket maximum amounts you will pay if enrolled in the ACDC plan will be $3,000 for an individual and $6,000 for a family on the Kaiser network, $3,500 for an individual and $7,000 for a family on a private healthcare network, $8,000 for an individual and $24,000 for a family on a non-participating network. Per IRS rules, employees enrolled on this plan are not eligible for a health savings account. Per IRS rules, only employees enrolled on the Kaiser High Deductible Health Plan are eligible for a health savings account. Employees are not eligible to have money deposited in a health savings account if they are enrolled on the Kaiser DHMO plan, are enrolled on the Kaiser Added Choice Deductible Coinsurance plan, are also enrolled in another health plan such as a spouse's plan, if that plan is not also a qualified high deductible health plan, are enrolled on Medicaid, Medicare, TRICARE, or have received veterans benefits 3 months prior to enrollment in a high deductible health plan. Also, you may not contribute to both a healthcare flexible spending account and a health savings account. You may, however, contribute to a dependent care FSA if you have a health savings account. For tax year 2016, the annual maximum contributions into a health savings account are $3,350 for an individual and $6,750 for a family. These IRS limits include both the employer and employee contributions. Employees age 55 or older can contribute an additional $1,000 annually into a health savings account for both individual and family coverage. This contribution may be made any time during the year in which the employee turns 55. It is a very good idea to try to maximize your health savings account funding each year. Your personal contributions to your health savings account are tax deductible and they do not reduce your PERA highest average salary. Your health savings account funds earn interest tax-free, and when you use your health savings account to pay for qualified medical expenses, such as doctor's office visits, medications, hospitalizations, emergency room, or urgent care clinic visits, you do not pay tax either. And if you leave School District 27J or change to a different health plan in the future, you may still use any remaining funding in your HSA to pay for qualified medical expenses. Remember, this is a use it or keep it fund. Another benefit of health savings account is that you may use your HSA to pay for qualified medical expense for your children or spouse, even if they are not enrolled on your District 27J high deductible health plan. Please note that if you use your HSA funds for your children or your spouse and they are not enrolled on District 27J Kaiser high deductible health plan, or if you use it for any medical items or services not covered under the Kaiser plan, that amount is not accumulated to the deductible. For example, if you use your health savings account to pay for braces, but will not receive deductible credit on your Kaiser high deductible health plan since orthodontia is not a Kaiser covered services. Personal voluntary contribution to your health savings account can be done through payroll deduction or by transferring funds from a personal bank account to your health savings account at HSA Bank. Unlike flexible spending accounts, you do not need to submit receipts to get reimbursed for your out-of-pocket expenses. You simply use your HSA Bank debit credit card to pay for your medical expenses at the time of service or when you are billed. We recommend that you keep all of your receipts each year in case you are ever audited by the IRS. If you were audited, you would need to prove that you use the health savings account for qualified medical expenses. If you use your health savings account for an expense that is not considered an IRS qualified medical expense, you would be subject to paying tax and a 20% penalty if you were audited. Please see the IRS publication 502 for a list of eligible medical and dental expenses for more information on qualified medical expenses. Before you can open a health savings account for the first time, School District 27J Benefits Department will notify HSA Bank of your eligibility for an account. You will then be sent an email from District 27J Benefits Specialist with instructions on and the online enrollment link for opening your health savings account at HSA Bank. You must open your health savings account within 90 days of the date of first contribution is sent to HSA Bank by School District 27J. Otherwise, the money will be returned to School District 27J and you will forfeit the money. School District 27J offers a self-funded dental plan which allows employees to obtain dental services from any licensed dentist, orthodontist, or oral surgeon. The claims administrator is Employee Benefits Management Services, also called EBMS. Employees are not issued a dental ID card. Instead, a dental plan claim form can be given to the dental provider. District 27J Dental Plan provides preventive or diagnostic dental services are covered at 90% without paying the annual deductible. Each covered member is limited to 2 oral exams and cleaning per calendar year. A maximum payout of $1,500 per member per calendar year. a maximum payout of $2,000 per member per lifetime for orthodontic services, a calendar year deductible of $25 per person if an employee enrolls as a family. Once two members of the family each meet the $25 calendar year deductible for a total of $50, the deductible will not be required of the other family members. Basic dental procedures are covered at 80% after single or family deductibles have been met. Major dental procedures are covered at 50% after single or family deductibles have been met. The School District 27J Vision Plan is offered through Vision Service Plan, also called VSP. You will not receive an ID card for the Vision Plan. Once enrolled, you may simply select an eye doctor from the VSP list of participating doctors that can be found online at www.vsp.com. Notify the eye doctor that you have VSP coverage at the time you make your eye appointment. The doctor's office will verify your coverage with VSP prior to your eye exam. One eye exam and lenses are allowed per plan year. The plan year is July 1st through June 30th. Frames are allowed once every 24 months. Effective July 1st, 2016, the frame allowance is $190 and the contact allowance is $170. Co-payments are $20 for an eye exam and $20 for materials when services are received from a participating VSP doctor. Services and materials provided from an out-of-network provider are allowed at a reduced payment schedule. District 27J employees and their families have access to an employee assistance program known as the EAP, provided by Resources for Living. The EAP is designed to help you and your family manage personal problems that are affecting your quality of life. These might be due to such factors as marital, family, or financial stress, emotional difficulties, drug dependency, or many other situations. The EAP is not just for people in crisis situations, but also to help with the everyday problems that we all face in life. The EAP offers up to 5 face-to-face confidential counseling sessions per presenting problem, free of charge, or unlimited telephone assistance for you and your household members. Local counselors provide them in the privacy of off-site offices. The EAP staff is available 24 hours a day, 7 days a week at 866-252-4468. Online resources are available at www.horizoncarelink.com in the areas of family, health, life, workplace, legal, financial, and more. Employees and their dependents do not need to be enrolled in District 27J medical, dental, or vision plans to be eligible to receive the free confidential counseling services. The school district offers 2 flexible spending account plans and a pre-tax premium payment option. The FSAs include a health care flexible spending account and a dependent care flexible spending account. Your flexible spending account election amounts are deducted from your monthly gross earnings pre-tax. This means your elected flexible spending account amounts and pre-tax premium amounts are deducted from your gross earnings before the calculation of federal tax, state tax, Medicare tax, and your mandatory Public Employers Retirement Association contribution. Also, your pre-tax premiums and contributions to flexible spending accounts will reduce your salary reported to Public Employers Retirement Association. This may result in a reduction of your PERA benefits you will receive when you retire. PERA members may want to carefully consider whether to participate during their 3 to 5 highest earning years, as this could affect their PERA retirement benefit for the rest of your life. Because flexible spending accounts provide tax advantages, the federal government imposes strict rules and limitations on enrolling, making changes, or using these accounts. You should consult your tax advisor or the IRS for guidance on how these options might affect your personal tax status. You should contact the Public Employers Retirement Association on how these options may affect your retirement. The pre-tax premium payment options allow you to deduct premiums that you pay for health, dental, and vision coverage from your paycheck before taxes and your mandatory PERA retirement contributions are calculated. This option reduces your taxable income and PERA includable salary and increases your take-home pay. The Healthcare Flexible Spending Account, or Healthcare FSA, can only be elected if you have chosen the Kaiser DHMO Health Plan, the Kaiser Added Choice Deductible Coinsurance Plan, also known as the ACDC plan, or if you are enrolled on a plan that is not a qualifying high-deductible health plan. The healthcare FSA is like a savings account that allows you to have money deducted from your paycheck before it is taxed to pay for eligible healthcare expenses that are not covered or reimbursed by insurance. As you pay for qualified expenses, you reimburse yourself from your FSA. The plan year is July 1st through June 30th. Remember that flexible spending accounts expenses must be incurred within the plan year or the funds are lost. You must contribute a minimum of $30 per month or a maximum of $200 per month or $2,400 per tax year to your healthcare FSA. The FSA enrollment form requires you to elect an annual plan year amount. This amount would be divided over 12 months of the plan year with the payroll deduction to begin in July payroll. For new employees, the FSA election deduction will begin the first paycheck and continue through the following June payroll. It is important to note that you will have to re-enroll during every annual open enrollment period if you wish to continue participation in the FSA the following plan year that begins July 1st. The IRS will not allow you to make contributions to both a health care FSA and a health savings account. When you incur eligible health care expenses, you submit a claim to HealthSmart, the flexible spending account administrator. HealthSmart will reimburse you by sending you a check to your home address. The IRS allows 2.5-month grace period at the end of the plan year to allow plan participants to incur expenses before losing money in their flexible spending account. The 2.5-month grace period ends September 15th, and claims must be submitted to HealthSmart by September 30th for reimbursement. It is very important to carefully calculate your annual election amount, since any money left in the FSA account after September 15th will be forfeited. For more details on qualified health care expenses and how the account works, please refer to the HealthSmart website at www.healthsmart.com. See IRS Publication 502 for more information on what is considered a qualified medical or dental expense. Please note that over-the-counter drugs are not eligible medical expenses unless you have a written prescription for them from your doctor. The Dependent Care Flexible Spending Account allows you to contribute pre-tax earnings to an account that is used to pay for dependent care, child care, or daycare expenses. Reimbursements from your Dependent Care FSA may reduce or eliminate dependent care tax credits allowed on your federal income tax return. For most people, the reimbursements from this FSA account provide a greater tax benefit, but everyone's tax situation is different, so it is best to discuss your situation with a tax advisor or refer to the IRS for guidance. The Dependent Care FSA can be used to provide daycare for your children under 13 years old and or your spouse or older dependents who are mentally or physically incapable of self-care and who live in your home at least 8 hours a day. You may contribute a minimum of $30 per month and a maximum of $416.66 per month per household. The IRS imposes a $5,000 maximum contribution per tax year, January 1st through December 31st. If you are married and filing separate tax returns, each of you have $2,500 maximum dependent care FSA contribution limits. The FSA enrollment form requires you to make an annual plan year election. If you enroll during the annual open enrollment period in May, the annual FSA amount will be divided over the 12 months of the plan year, which is July 1st through June 30th. For new employees, the FSA election deduction will begin on the first paycheck and continue through the following June payroll. Reimbursement is limited to the balance of your Dependent Care FSA account at the time your claim is submitted, and you must incur expenses prior to reimbursement. It is important to note that you will have to re-enroll or enroll in this plan during open enrollment period if you wish to continue participation. The first payroll deduction of a new plan year will begin on the July paycheck. When you incur eligible expenses, you submit a claim form to HealthSmart, the flexible spending account administrator. They will reimburse you by sending you a check to your home address. The IRS allows a 2.5-month grace period at the end of the plan year to allow plan participants to incur expenses before losing money in their flexible spending dependent care account. The 2.5-month grace period ends September 15th, and claims must be submitted to HealthSmart by September 30th for reimbursement. It is very important to carefully calculate your election amount, as any money left in the account after September 15th will be forfeited. For more details on qualified expenses and how the account works, please refer to the HealthSmart website at www.healthsmart.com. The purpose of life insurance is to ensure the financial security of your family in the unexpected event of your death or dismemberment. School District 27J offers group term life and accidental death and dismemberment coverage with the Standard Insurance Company. All eligible employees will have life insurance coverage in the amount of 2 times the employee's annual base salary, rounded to the nearest thousand. It is important to name your beneficiaries on the enrollment form for your life insurance policy. Please use whole numbers when electing the percentage of coverage for your beneficiaries. You may change beneficiary designations at any time. The Public Employers Retirement Association offers Unum Voluntary Decreasing Term Life Insurance to PERA members. PERA members must apply when first enrolled or during the annual PERA Life Insurance Open Enrollment period. If interested, contact PERA or visit PERA's website. Enrollment is not handled by School District 27J. Membership in the Temporary Sick Leave Bank is offered to employees in lieu of disability insurance. There are 2 leave banks, one for the certified employees and one for classified employees, and the membership requirements are slightly different for each leave bank. Please refer to the appropriate union agreement for details on membership requirements. The purpose of the temporary leave bank is to allow bank members to draw temporary leave days donated by other employees in their serious illness injury or serious illness injury of an immediate family member that extends beyond the number of their own accumulated temporary leave days. If a bank member needs to request days from the temporary leave bank, a temporary leave bank application form, along with a physician's verification of medical absence form, must be submitted to the District 27J Human Resources Office. Colorado Public Employers Retirement Association, or Colorado PERA, is a mandatory retirement plan in lieu of Social Security for all Colorado School District employees. 8% of the total monthly adjusted gross wage is deducted from the employee's salary and deposited into the employee's retirement account. For 2016, the school district contributes 19.15% of the total monthly adjusted gross wage into PERA Trust Fund. For more information, call PERA at 303-832-9550 or 1-800-759-7372 or visit PERA's website at www.copera.org. A variety of 403B tax-sheltered annuity retirement plans are available for voluntary employee participation. Payroll deductions to voluntary retirement accounts are deducted pre-tax. If you want to voluntarily participate in the 403B by having pre-tax money deducted from your paycheck to go into your 403B account, you must first open your voluntary retirement account with one of the 403B providers shown on the authorized District 27J payroll deduction list. You must contact a representative from the 403B company to open your 403B account. After you have opened your 403B account, then you must fill out an Omni Group Salary Reduction Agreement found on the Omni website at www.omni403b.com and mail or fax the salary reduction agreement to Omni to authorize the amount you want deducted from your paycheck each month. Payroll deduction changes can be made any month as long as the salary reduction agreement has been received by Omni Group by the 12th of the month. Employees may also participate in the PERA Plus 401k voluntary retirement plan. District 27J does not match contributions an employee makes into their PERA Plus 401k account. Information about the PERA Plus 401k plan is available on PERA's website at www.copera.org. District 27J offers eligible employees a choice between 3 different Kaiser medical plans and have outlined the main differences between the Kaiser DHMO plan, Kaiser High Deductible Health Plan with a Health Savings Account, and the Kaiser Added Choice Deductible Coinsurance Plan. As you are making the decision for you and your family, you will want to consider your potential out-of-pocket costs, which include the monthly premium costs and your out-of-pocket costs when medical services are received. You can use a Kaiser treatment cost calculator and the Kaiser sample fee list to help you estimate your potential out-of-pocket costs as you go through the decision-making process. You can also call the Kaiser Member Experience Team at 338-3990 for assistance with potential out-of-pocket costs, including pharmacy costs, based on enrollment on each of the health plans. We've presented an overview of the benefits offered to you as an employee of School District 27J. Please review all of the information as you prepare to enroll to ensure you are making the best decisions for you and your family. Remember, you will have 31 days from your first day worked in a benefit-eligible position to submit your enrollment forms and any required supporting documents. Your benefit enrollment elections will remain into effect until the end of the plan year, typically June 30th. Due to healthcare reform, if you do not submit an insurance enrollment form or waiver form, you will be automatically enrolled in the Kaiser High Deductible HSA Compatible Health Plan. This plan is the district's base health plan. Please complete the enrollment forms using black ink. Your employee signature is required at the bottom of page 1 and on the back side of the health, dental, and vision enrollment and change form. Please return your completed forms to School District 27J Human Resources Office. This concludes our overview of the benefit options and retirement plans available to you as an employee of School District 27J. We encourage you to review all of the information available to ensure your successful benefits enrollment. Please don't hesitate to contact Sherry Primus, Benefits Specialist in School District 27J Human Resources Department with any question. Sherry can be reached at 303-655-2967. On behalf of the Human Resources Department and School District 27J, we welcome you.